coronavirus outbreak is killing people.
Open Ohio now! Open Ohio now!
December 31st, 2019. China alerted the World Health Organization to several cases of what it called unusual pneumonia in Wuhan, a city of 11 million people. January 1st, 2020, as health experts worked to identify the unknown virus, the alleged source of origin, the Wihan seafood wholesale market, was shut down. But it was too little, too late. January 14th, the WHO tweeted that there was no human-to-human transmission of the virus. It could not have been more wrong. In the 4.5 months since, the coronavirus has brought daily life to a grinding halt in much of the world. Despite the best efforts of scientists, there is still much we do not know and understand. A planet-wide experiment to try and find answers is in full swing. Here are some of the big questions that must be answered. Where exactly did the coronavirus come from? How deadly is it really?
This is very distressing to me because I don't know if this is going to be the next shift that I go in and I get the virus.
What are the full range of symptoms? How exactly does it spread? Can the virus mutate? Are we any closer to finding a cure? And most importantly, can China shrug off its responsibility? Lies, deceit, and a mounting death toll, the COVID-19 pandemic has challenged our modern civilization, and it has changed the way we live forever. On the show today, we track the journey of the coronavirus from Wuhan to the rest of the world. We look at all the critical moments of the coronavirus crisis. Perhaps it will answer some of the questions that we have posed. The earliest date of symptoms onset, according to a study in the journal Lancet, is December 1st. 7 days later, on December 8th, a patient in the Chinese city of Wuhan sought medical help for pneumonia-like symptoms. Local hospitals in the Hubei province reported 4 cases of a pneumonia of unknown etiology on December 29th. All the cases were linked to the Wihan seafood wholesale market. They were identified by local hospitals using a surveillance mechanism. This method was developed more than 17 years ago in the wake of the SARS outbreak. The severe acute respiratory syndrome was first noted in the Guangdong province in China in November 2002. The virus, thought to have originated from bats before transferring to civets, was aggressive and lethal. The Chinese government was criticized for responding slowly to the outbreak and concealing the seriousness of the illness. It spread to much of the world, although most cases remained in Asia. Before fizzling out, the SARS epidemic affected 26 countries and resulted in more than 8,000 cases and 774 deaths. 17 years later, on December 31st, 2019, China reported a cluster of cases of pneumonia in people living in Wuhan. This time too, the responsible pathogen was another coronavirus that managed to jump species from animals to humans. The Wuhan seafood wholesale market was shut on January 1st, but by the 7th, the number of suspected cases had risen to 59. The World Health Organization announced that they had identified a new virus, the novel coronavirus or 2019 nCoV. China announced its first death from the novel coronavirus on January 11th. This was reported 2 days later after a 61-year-old man who had purchased goods from the seafood market was admitted to a hospital. Thailand became the first country to report a coronavirus case outside China. A 61-year-old woman, a Chinese tourist from Wuhan, the city from which the outbreak originated, tested positive. By January 14th, Wuhan started implementing screening measures for travelers leaving the city at airports, railway stations, and other passenger terminals. But there were no travel restrictions. Japan became the second country to report a confirmed coronavirus case outside China. The first coronavirus case in Japan was reported on January 16, a man in his mid-30s who had visited Wuhan. On January 17th, the second fatality took place in China. A man aged 69 died in Wuhan. While in Thailand, a second case emerged, a 74-year-old woman. A day later, a third person died from the coronavirus in China. On January 20th, the Chinese Center for Disease Control and Prevention categorized the novel coronavirus as a Class B infectious disease, but stated that the agency would be adopting Class A measures to prevent and control the virus. A confusing statement. On the same day, China confirmed a fourth death, an 89-year-old man. Chinese state TV also confirmed that human-to-human transmission was taking place, but the country implemented no travel restrictions. By now, South Korea too confirmed its first case. America reported its first coronavirus case in the state of Washington on January 21st, a man with a travel history to Wuhan. At the same time, new cases were announced in China, including in Beijing, Shenzhen, and Shanghai. But the ugly face of the coronavirus started showing when China confirmed that 15 medical workers in Wuhan had been diagnosed with the coronavirus. On the same day, Hong Kong and Taiwan confirmed their first cases. Singapore confirmed its first case on January 23rd. By now, China's CDC had reported 830 patients in mainland China and 25 deaths. The first fatality outside of the Hubei province was reported in Hebei. And finally, Wuhan was placed under a sweeping quarantine. As expected, multiple countries started reporting coronavirus cases. But the WHO still did not declare the outbreak a public health emergency of international concern. Nepal, Vietnam, France, and Malaysia confirmed their first cases. In Wuhan, construction crews started working on 2 new hospitals to accommodate the influx of patients, and it was clear that the mysterious virus had overwhelmed medical workers. doctor from China's Hubei province, the epicenter of the fast-spreading virus, died on January 25th due to the deadly disease, becoming the first medical professional to have fallen victim to it. Meanwhile, Australia and Canada confirmed their first cases. January 25th also marks the first day of the Chinese New Year. It is China's busiest travel season, as hundreds of millions crisscross the country to get home for the Lunar New Year family reunions. Nearly 5 million people had left Wuhan before travel restrictions were imposed ahead of the Chinese New Year. On January 26th, Chinese authorities announced a ban on wildlife trade in markets, supermarkets, restaurants, and e-commerce platforms. The highly unsanitary conditions under which wild animals are illegally traded had already been proven to create ideal conditions for viruses to cross the species barrier to humans after the SARS outbreak. This was a clampdown that China should have implemented in 2003. The Wuhan virus continued its deadly spread and more countries joined the list. Cambodia, Sri Lanka, Germany reported infections by January 27th. The United Arab Emirates confirmed its first case, and then Finland. Airlines in America, Europe, and Asia started suspending flights to China. On January 30th, India confirmed its first case in the state of Kerala, a student who had returned from the Wuhan University. Philippines too reported a COVID-19 infection. The United States confirmed its sixth case, the first person-to-person transmission of the coronavirus in the country. It was at this juncture that the WHO declared the coronavirus outbreak as a public health emergency. And within 1 month of reporting its first case, Germany found evidence of asymptomatic transmission of the coronavirus. Russia, Italy, and the United Kingdom reported their first cases. The Wuhan virus had reached more than a dozen countries across the globe, but for the WHO, it was not a pandemic yet. India's national carrier, Air India, conducted its first evacuation process out of Wuhan on the 1st of February. Ahead of the first flight, the Indian government sent two of its diplomats, Deepak Padma Kumar and M. Balakrishnan, to Wuhan by road through Changsha city. In the first flight, 324 Indians were evacuated, setting in motion one of the largest evacuation operations in history. The Huoshenshan Hospital, which was set up in a record 10 days in Wuhan, admitted its first batch of patients suffering from the novel coronavirus on 4th February. A baby in China's epidemic-hit Wuhan city was diagnosed with the novel coronavirus just 30 hours after being born. The mother had tested positive for the virus before she gave birth. On February 7th, Japan confirmed 10 cases of the coronavirus on a cruise ship. The ship, called Diamond Princess, was quarantined for nearly a month, with almost 4,000 passengers and crew on board. At least 712 passengers and crew were infected, and 14 succumbed to the disease. This was the day when Li Wenliang, one of the 8 whistleblower doctors in Wuhan, died from coronavirus-related complications. On December 30th, he sent a message to fellow doctors in a chat group warning them to wear protective clothing to avoid infection that he thought looked like SARS, another deadly coronavirus. But later, he was harassed by authorities and asked to stop making false comments and spreading rumors. The death of the heroic doctor sparked outrage on Chinese social media. Wuhan government owes Dr. Li Wenliang an apology, and "We want freedom of speech" started trending, but the hashtags were quickly censored. However, China could not bury the truth about the Wuhan virus. The US and China have been at loggerheads since the start of the coronavirus pandemic, and tensions between the two have escalated. But in February, when Trump and Xi Jinping spoke about the coronavirus, Trump actually praised China's efforts and pledged support. The WHO named the disease COVID-19, short for Coronavirus Disease 2019, on the 11th of Feb. And on Feb 21st, the next would-be epicenter, Italy, reported its first death. Italy closed public spaces in 10 towns after confirming 16 cases in the northern part of the country in one day. By the end of February, 60 countries were battling the deadly infection. A patient infected with the novel coronavirus in Washington state died, marking the first death due to the virus in the United States. Washington declared a state of emergency, becoming the first American state to do so. After reporting its first confirmed cases on February 19th, Iran decided to temporarily free 54,000 prisoners to curb the spread of the coronavirus. Iran's deputy health minister, Iraj Harichi, was seen sweating profusely at a news conference before testing positive for COVID-19. Italy declared a nationwide lockdown on March 9th. The Italian outbreak has been traced to a 38-year-old man who sought treatment at a hospital in Codogno near Milan on Feb 18th, where he infected dozens of patients and medical staff. He had not visited China, and how he became infected remains a mystery. 2 days later, the WHO declared Europe the new epicenter of the outbreak. A surge in cases was witnessed in Germany, France, and England. The World Health Organization declares COVID-19 a pandemic, pointing to 118,000 cases of the coronavirus illness in over 110 countries and territories around the world. The organization has been criticized and second-guessed for not declaring the outbreak a pandemic sooner. On the same day, India recorded its first coronavirus death. A day later, stock markets across the world witnessed a bloodbath, indicating the world is nearing a new kind of recession. The Indian stock market entered bear territory on March 12th, and the blue chip Nifty 50 slipped below the 10,000 mark for the first time in 2 years. The Indian government suspended all tourist visas and e-visas for travelers till 15th April, and the United States issued a 30-day travel ban from Europe. After almost all major sporting events were cancelled due to the pandemic, Japan finally postponed the 2020 Summer Olympics for the first time since World War II. On March 25th, India entered the world's biggest lockdown. The decision came just 2 days after the Janta curfew or a voluntary lockdown on March 22nd. The lockdown has been extended twice since then, and Sikkim continues to be the only Indian state that is free from the clutches of the Wuhan virus. In England, Prince Charles became the latest celebrity to test positive for COVID-19. The 71-year-old went on to make a full recovery. By now, the focus had shifted from China to the United States. New York City became the epicenter of the US outbreak, with reported coronavirus cases doubling every 3 days. Nurses and doctors were seen in distress as the world's richest nation ran out of PPE kits.
We had a few patients die in the emergency room because the hospital's full.
The morgues are already getting overwhelmed.
It just feels like you're standing on the shore looking at a tsunami, and the federal government is offering you a life preserver.
This is one of the most dramatic things that I've ever seen.
British Prime Minister Boris Johnson confirmed that he had tested positive for the coronavirus on March 27th, making him the first major governmental leader known to have contracted the disease.
On the advice of the Chief Medical Officer, I've taken a test that has come out positive, so I am working from home.
The same day, Britain shut non-essential shops and services and ordered people to stay at home except to shop for groceries and medicines. By the end of March, coronavirus cases in the United States topped 140,000, more than any other country in the world. A local viral outbreak at a wet market in the Chinese city of Wuhan was threatening the lives of millions of people. Flights were grounded across the globe, streets were lying empty, and the tourism sector was on the brink of collapse. China had managed to bring the world to a standstill. The US intelligence community alleged that China has concealed the extent of the coronavirus outbreak in its country, underreporting both total cases and deaths. On April 5th, a tiger at the Bronx Zoo in New York tested positive for the coronavirus. The 4-year-old female Malayan tiger named Nadia contracted the virus from a zookeeper who was asymptomatic. After Nadia, 3 other tigers and 3 African lions in the same zoo exhibited symptoms and were found to be positive. It was soon evident that animals can get the virus from humans. After 76 days, the lockdown in Wuhan ended officially just after midnight on April 8th. Wuhan returned to life, but the rest of the world continues to struggle with the Wuhan virus. The global death toll due to the coronavirus crossed the 100,000 mark, with Italy, the US, and Spain accounting for over half of the fatalities. Despite the global uproar, China reopened some of its controversial wet markets on the 12th of April. The coronavirus crisis has many world leaders, lawmakers, and health officials calling for wet markets to be shut down permanently, but the plea appears to be falling on deaf ears in Beijing. The fight to contain COVID-19 hit a major snag when countries counted on China for help. China, the world's main supplier of PPE kits, sent poor quality consignments to numerous countries, including India. In the United States, roughly 36 million people filed for jobless aid in the 2 months of lockdown. The US economy lost a staggering 20.5 million jobs in April, the steepest plunge in payrolls since the Great Depression. The world's biggest economy was battered by the Wuhan virus. In China's pandemic epicenter of Wuhan, a new cluster of cases has sparked a mass screening campaign. The world has to live with the Wuhan virus. It is the new normal. But how do we tackle the burden of a highly infectious disease that could recur annually like the seasonal flu, but is much, much more lethal? Well, don't look to China for any answers.